Hi, my name is Caroline, founder of Equitopia. As we explore the many complexities and considerations involved in better understanding how to successfully partner with our horses, in this video we talk to professionals in the industry to point out some subtle signs in a horse's top-line development that may indicate an underlying physical problem that may, without addressing the underlying sources, over time become a more chronic lameness issue.
Everybody knows what the top line is. That's the line from above the horse. So it's from the skull, the neck, the withers, the back and all the way to the pelvis. And first we thought, well, if a horse has kissing spine, the horse has kissing spine. But now we know if a horse has kissing spine, he has more problems in the back or in the neck or in the skull. So that's why we speak about the top line syndrome. Because if a horse has a problem in the back, it's not just that one problem, there are more problems at the same time, and that's why we call it syndrome.
The muscles along the spine, so from base of the skull all the way to the tail, have atrophied. Now they may have atrophied for a variety of different reasons, or they may have been impinged upon for a variety of different reasons. It can be pain, it can be tack, it can be chronic lameness. You know, there's lots of reasons for those muscles to atrophy or to have never been developed.
We're looking now at a 9-year-old gelding. His name is Dreamer. And Dreamer is a typical modern dressage horse. Very tall, very long body and a narrow horse. And that makes him a very good horse with very good movements, but he also has problems stabilizing his own body. And if we look at this horse, we can see some things that tell us that he has some problems in his top line. And a very nice thing to have a look at is his manes. Because this small part of his manes, whatever I do, will always flip over to the left side. And that tells me that something is going on in this part of his neck. And we can also see that the line of his neck is not very fluent over here. So what we do not see in this horse is the swelling at C2. That's good, because the swelling in C2 almost always happens because a horse is ridden behind the vertical and there is too much pressure. Further, what we can see is there's a dip in front of the withers. And behind the withers, there's also a dip. And it seems like the musculus trapezius hasn't developed very well. But that's not the case, because what he does, he is standing like this and his core is sinking.
Hans Ahrens is a thermographer and farrier and works with Karen at Equicare Plus. We asked him to explain the theory behind how a horse's core can sink.
We see the C7 over here is the last cervical vertebrae, and this is the transition to the T1, the first thoracal vertebrae. What we see a lot is that it's not in a right connection, there is a tension on it. The C7 gives a lot of tension in the first thoracal vertebrae, but also in the second, the third. We see that the rib is connected to the vertebrae and the rib is connected to the sternum, which means that the tension in this area will be brought to the sternum. On the sternum we see that all the pectoral muscles are connected. One of the most important one in this case is the subclavius, which is connected here in this area. Point is, when the tension in the top line is that big, a horse is never be able to use the muscles from the belly, which means that it is very difficult to lift the back and to lift the wither.
Now we have this muscle, the brachiocephalicus, that's going from there to there. And this muscle, when I touch it gently, he doesn't like it because it's painful. And that is due to the fact that his core is going down, and his core and the weight of the front part of his body is sort of hanging in this muscle. And this muscle is actually here to get the front leg forward, not to keep all the weight from the core. So if we ask him politely, and he's big enough, then we can see, yeah, that the core is coming up. And then he has his muscles back again. So this horse is naturally crooked, just like every horse. But because he's a very big horse, his crookedness is a bigger problem for him than for smaller horses with a smaller constitution. And what he does, he's bending his body a little bit to the right, and he's pushing his weight with his right hind leg to his left front leg. And that's why the muscles here in the area of the shoulder, they are more developed than the right one, because he has to carry more weight on this side. And that's also why there's more muscle tension in the shoulder area on the left side than on the right side. Another thing we can see is swelling here in front of the scapula. And when I touch him and feel him, he has a lot of tension in this area. That means he has to compensate because in the inside of the scapula there's so much muscle tone and tension that he cannot keep his legs in straight position. So when we have a look at the front of the horse, we can see that the left front foot is toeing out a bit more than the right.
Like many things in the horse world, there's very little research, but a lot of anecdotal evidence to suggest that tension inside the shoulder blades may actually cause an otherwise conformationally correct horse to toe in or toe out. Bodyworker Jeroen Dunk explains.
You can imagine that on the inside of the shoulder blade there's a tension, the shoulder comes in. So the elbow comes out and the toe comes in.
When these thoracic sling muscles are strong and properly conditioned, as well as the horse's core and back muscles, the horse is in a state of elevation and carriage. The withers are lifted, the sternum is elevated, the rib cage comes out, and the shoulders come out. If that patient has a rehabilitation or an injury or is ridden hollow incorrectly, had a neck high and the back hyperextended, it is possible then, because these shoulders are only attached through those soft tissues, and the horse's core will actually begin to drop between those shoulder blades.
If a horse's shoulder blades aren't moving because they're standing around, or because they've been restricted because of saddle fit or training or poorly fitting neck collars and that sort of thing, any of those things can cause muscle atrophy underneath the shoulder blade. And the muscle atrophying means that there's not as much mobility, basically, because all you have left then at that point is the connective tissue.
When you loosen up your shoulders, or the horse can lift his withers, the scapula has a lot of range of motion.
Here's a photo of Dreamer's feet, taken in June 2017. After 5 months of training, bodywork and hoof balancing, and although his front feet aren't completely straight, they do appear to have become straighter.
Sydney here has an example of what we call a kissing spine lesion. That's this bump in his lumbar spine. Kissing spine lesions can actually occur anywhere along the spine. If you were to look at it on an x-ray or a radiograph, is a bridging that's formed, made up of bone between the dorsal spinous processes of the vertebrae. And this usually is caused when a horse hyperextends through the hind end, a horse that trips, catches its hind feet and actually snaps through its back. Over time, the dorsal spinous processes clack together, cause irritation in their fibrosis and actual mineralization or a bridging and bonding of those spinous processes.
Many veterinarians and trainers also believe that riding a horse hollow may create friction in the spinal processes.
So here we see the spinal processes and they change direction a little bit. So if the horse makes a hollow back, the processes go like this and we get kissing spines.
Dr. Diane Isbell uses both X-ray and ultrasound to identify kissing spines.
The ligaments in the bone from one dorsal spinous process to another should be flat. But what's happened, he's gotten a bone reaction that has spurred out about 1 centimeter from each side of the spine. This horse is more counterbent when going to the right, and that's because it's painful for him to stretch the muscles and because of bone reaction at the attachment. This bone, the sides of the dorsal spinous process, should come straight down here. and straight down here, and you see that it's bowed out. So there's been long-term pulling on this muscle that's caused the bone to remodel and become thicker there. So our goal is to help him feel more comfortable here so that he's able to bend correctly to the right. And this can be a reason he has a history of bolting. If the saddle is sitting too close, the saddle would have to sit, the weight bearing has to be all the way out here for this horse to be comfortable.
Horses can also get arthritis in the facet joints. And when those joints become painful, the back doesn't move correctly. When the back is restricted, muscles atrophy. And as a result, kissing spines can develop. And the cycle of inflammation and joint breakdown continues.
So when we go further backwards, we see the flexion here in the lumbar area.
So the lumbosacral joint has the largest range of motion in the hind end of the horse. So when that area starts to have a problem, you see, again, muscle atrophy in that area because they stop being able to use the lumbosacral junction as well as they should.
Some of the diseases or pathologies we might see would be an SI tear, so a tearing of the fibrous tissues or the sacroiliac ligaments, which then can result in what we call a hunter's bump. One side or both sides may appear higher on the croup of the horse.
You can also see a lack of muscle development secondary to nobody asking them to engage that lumbosacral joint.
So when we look at the tail of the horse, we can see that he's carrying his tail to the left.
If the left sacroiliac isn't moving correctly and it has a reduced range of motion, then oftentimes that tail will get pulled off to that side secondary to the muscle tension on that side. So if you're a horse owner and you want to try and maintain your horse's fitness, particularly its spinal fitness, I think the best resource is probably working with a good and qualified trainer that can help guide you on how your horse is moving, help be eyes on the ground, and help with actually riding your horse. So a good active training program is far and away the best way to keep a healthy top line on your horse.